So I have my patient here, Paul. Paul's 5 days post-op. He had upper blepharoplasty, lower blepharoplasty, and fat transfer, all done under local anesthesia. And one of the unique things, I mean, this is kind of a very run-of-the-mill surgery for us, but one of the very unique things about Paul is he's one of the first patients where we did our extended post-operative protocol, and we included hyperbaric oxygen in hard tank hyperbaric oxygen. So take it away, Paul. How do you feel? What did you feel about the treatments? What did you feel in terms of your recovery, your healing, all those kinds of stuff?
I mean, it being a very easy breeze, I think it helps a lot with the swelling. And I mean, I feel great. I mean, I didn't have to take any pain and sleep really well. And seem like, you know, swelling is you know, what, 5 days. So it's, you know, it's a lot less than, you know.
Absolutely. So, you know, when we analyze Paul here, he just has a little bit of swelling and very minimal bruising right along the orbital rim there, which is pretty good, especially for male patients who tend to bruise and swell a little bit more because they have thicker skin and tend to bleed just a tad bit more. I have a couple of questions for you. I know when you originally sought me out and we talked and all these types of things, you had already seen several other surgeons in the past. Did you find that this type of post-operative protocol was common amongst the surgeons that you interviewed?
No, they don't have any of those things, and that's why I really did, you know, flew here. You know, it was harder than being home. You know.
Absolutely,
I mean, you gotta be in and out of the hotel. You gotta, you know, it just, you know, it's a lot way more expenses. You know, with the eating, hotel, flight. You know, you bring somebody and all that, but because of, you know, my research about you and how you approach things and with the post thing when we talk online, you know, over the Zoom, and I feel like this is the person that I wanna, you know, that go with. Yeah.
So first of all, from my staff, from me, from all of us, thank you so much. Okay, it really means the world to us. Let me tell you why. Okay, so I think first of all, tons of surgeons. Okay. All surgeons, and I wrote an article about this weekend, so I really kind of organized this. All surgeons really concentrate on the surgical outcome, okay? How do I do the surgery? Let me get better and better. I think this is common. That's good. We want to get better and better about surgery, and I'm the same way.
Yeah.
But we forget one thing, which is the surgical experience. What does it feel like for the patient, okay? So it's not just what the end all, what it looks like. It's also what it feels like. And in that what it feels like, we want patients to get better as soon as possible, right? Like today, you're literally 5 days post-op. I'm sending you back home, okay? You have healed to the point where there's nothing I'm going to do anything. And this type of rapid recovery is only because of all these ancillaries. Otherwise, I would have probably had to keep you here for another 3 to 4 days just to make sure that everything's going according to plan.
Yeah.
So, you know, I think, you know, this really does make a difference overall to patients' outcome. You're, you know, living proof sitting here, you know, because I mean, truly, I bet you if you wore just a pair of glasses and go around, 99% of people wouldn't even know you had surgery 5 days ago.
Yep.
Now, I have another question, last question before I let you go. Local anesthesia. So, you know, I did local anesthesia on you, okay? I don't do local anesthesia on a lot of men, okay? I do find that men have a little bit more bruising, swelling, little bleeding intraoperatively, and most of them just say, I want to go to sleep. For you, you understood that, hey, it's going to help my recovery process. How did it feel? If you could talk to other men, what would you say? Did it hurt? Was it bad? Does it?
No, I mean, if you get over your fear, you know, I think the medicine which just numb you, it just, you know, just. I mean, I fell to sleep, right?
Yeah.
I guess. I mean,
you were snoring a little bit, yeah.
I mean, I didn't feel any pain, just slight pressure, you know. Of course, you feel a little bit of pain afterward, a day, 2 days, but it's so minimum because of his post-recovery procedure. But now, I mean, I feel just normal. Besides just a little tight here and there, it's just normal. You know, it's only been 5 days, and it's very easy process. Put it that way. Very, very easy process.
Would you do it over?
Yes.
Okay. Well, good. Again, from all my staff here, thank you so much for making the trip down here. Thank you for being our patient, and we'll see you in a couple weeks.
Yep. All right.